Hello, welcome. Thank you for joining us. My name is Steve Kelso. I'm the Communications Manager here at the Kent County Health Department. This is Christopher Bendekgey, and he is the Director of our Clinical Services Department. Thank you for joining us
Thanks
today.
for having me, Steve.
We've been getting a lot of questions about COVID-19 testing, and it's Christopher's division that runs all of this. So thanks for joining us today, and let's maybe help the people understand why it's important that I get tested for COVID-19, what it looks like when I come in and make my appointment, how do I make that, and is it free?
Sure. So again, thanks for having me, Steve, and I'm glad we can have this conversation. So to be tested, if you want to be tested for COVID-19, you can go to the Kent County Health Department's website through accesskent.com and click on the testing link, and on that list all the locations that you can be tested for COVID, including some of the pharmacies and other healthcare providers in the area. If you're choosing to come to one of our sites, we would just ask that you pick the location that you want to, enter your information into that site, pick the time, and register. And then come the day of your test, and we'll get you in and out in about 3 to 5 minutes.
3 to 5 minutes. How far out do I have to register to make that 3 to 5 minutes work for me?
Yeah, so we're seeing you can get an appointment within 24 to 48 hours.
That's really amazingly quick. And how fast now am I getting results back?
Yeah. During this last 2 weeks, we have made significant improvements both on our end and with the lab that we utilize to process our specimens. We've been working very hard in concert to try to come up with a very streamlined process. In doing so, we've been able to cut down the test result time from what was anywhere between 4 to 8 days to right now we're seeing test results come back within 24 to 72 hours.
And really, as far as public health goes, it is critical to get that information in the hands of the people and in the hands of our epidemiologists for contact tracing purposes as soon as possible, isn't it?
Absolutely.
And so that really is a big advancement.
Very much so, yes.
How do I know that all of the results that you give to me are kept private? And what do I do if I have an employer who is demanding to know my status?
Thanks. Good questions. So first and foremost, all your personal information is kept private. It's your personal medical information. Nothing is shared. We do have to provide some data to the state of Michigan for reporting purposes. However, nothing else is shared with anyone else. When we get your results, we will contact you at the phone number that you have provided us when you registered, and we will communicate. We ask you some questions to make sure that I'm actually talking to you, and then we will provide those to you over the phone. If you need a copy of your results for your employer or another reason, we can send that to you via an encrypted email or through the U.S. Postal Service.
All right. How do I know when the phone rings that it's really you? You say you've got ways to check that you're actually talking to the person who's being tested. There's a lot of scams out there these days, and how do I know then when that phone rings that it's really you calling?
Sure. So that's partly the reason why we actually call. So we will identify ourselves. We will then ask you some questions to know that we are speaking with the individual that is actually on our form. And I don't want to give too much information because that might reveal some things. But we go through a series of steps to verify that the individual that we're talking with is the individual that we need to communicate those results with, but at the same time giving you some assurance that it's actually the Kent County Health Department contacting you.
All right. The most important thing that people watching this should know about COVID-19 testing, whether it's here at the Kent County Health Department, is
get tested. If you feel that you're symptomatic or you've been in contact with an individual who is positive or symptomatic, you should be tested.
All right, very good. Christopher Bendekgey, thank you for joining us today. We are going to put the links underneath this video so that you can click on, make your appointment now, call in and get your appointment if that's the way you would rather do that. Thank you for joining us again. I'm Steve Kelso at the Kent County Health Department, and look forward to talking to you again soon.